The Ebola crisis in Sierra Leone has taken a new twist on Wednesday. Burial teams in two districts have gone on strike over pay, raising the risk of the virus spreading even faster. Workers say they haven't been paid weekly risk allowances for at least 2 weeks. The government says the issue will be resolved within days. Meantime, the head of the U.S. Centers for Disease Control says there are real signs of progress in the fight against Ebola. Speaking to VOA at the CDC headquarters in Atlanta, Georgia, Tuesday, Dr. Thomas Frieden said this includes better training, more understanding of the virus, and safer practices, including during burials for Ebola victims.
I think all of us who've traveled to the region have just been stunned by how bad the situation is and how rapidly it's changing. The things that are changing for the worse are the number of cases and the fact that our systems there are still overwhelmed, particularly in Liberia. But things are also changing for the better. We're seeing a more robust response, we're seeing a more organized response from countries, we're seeing focused action, and we remain confident that we can turn it around.
Frieden said there are no new cases in Nigeria and the outbreak in the Democratic Republic of Congo is contained. He also said there is a decrease in the number of new cases in parts of Liberia, one of the hardest hit countries. The U.S. military is spending $750 million over the next 6 months to battle Ebola in Liberia. 2 new mobile medical laboratories were deployed last week, and 4,000 U.S. service members are being sent to the region.
The real critical thing to this, based on the USAID and the CDC, is to get about 70% of the personnel that are infected into a treatment facility. And then at that point, they believe the curve will start going down. And then it will be based on how fast and how effectively, one, the curve turns down, and two, the international community can then pick up all the requirements. So we're going to stay as long as we're needed, but not longer than we're needed.
The United Nations Budget Committee approved $50 million for an emergency Ebola response mission and a special envoy's office through the end of the year. And the European Union announced Tuesday it is airlifting emergency supplies to handle the Ebola crisis in Guinea, Liberia, and Sierra Leone. Ebola has taken about 3,500 lives in West Africa since the outbreak began last year. Guinea, Liberia, and Sierra Leone are the hardest hit countries.